Okay, Assalamualaikum and a very good afternoon. I would like to kindly thank each and every one of you for joining us live from MAHSA University, Bandar Sarjana Putra. I'm Nadia Kamal from Faculty of Health Sciences, MAHSA University, and I will be moderating today's session. Today's webinar is hosted by the Faculty of Health Sciences, MAHSA University, and the title of today's webinar is Functional MRI, fMRI in Research and Emerging Clinical Applications. Dear viewers, before we proceed further, I would like to give you a brief overview of the programs that we offered by the Faculty of Health Sciences, MAHSA University. Okay, in the Faculty of Health Sciences, we have two departments and one school, School of Physiotherapy, Department of Environmental Health, and our department, Department of Medical Imaging. So under the School of Physiotherapy, we have Diploma in Physiotherapy, Bachelor of Physiotherapy, Conventional and ODL, and also the Master of Physiotherapy. Under the Department of Environmental Health, we have Diploma in Environmental Health, Bachelor of Environmental Health and Safety, Bachelor of Environmental Health and Safety ODL mode, and also the Diploma in Occupational Safety and Health. Under the Department of Medical Imaging, we have Diploma in Medical Imaging, Bachelor of Medical Imaging Honors, and also Bachelor of Medical Imaging by ODL mode. ODL is open and distance learning. Okay, so why join health sciences? So basically, the health sciences is have a high demand job, as it is classified as the essential services. We do not have a boring work routine. Basically, we meet a new people every day. It has lucrative remuneration, low risk of job redundancy, opportunity to work in variety of setting, as well as a career that you can feel good about yourself as you're helping people every day. So let's move on to the first program. We have Master of Physiotherapy, which is offered 1 year if you are doing full-time mode and 2-year programs if you are doing part-time. The entry requirement for the Master of Physiotherapy is bachelor degree or bachelor degree or equivalent with minimum CGPA of 2.5 in the related field. Or if you do not get 2.5 CGPA, you can be accepted if you have 5 years working experience in the related field. So don't forget the English proficiency for the international students. That would be IELTS 5.0, TOEFL or TOEFL IBT. So let's move to the bachelor programs. We have these 6 programs, and the entry requirement for the 6 programs is minimum GPA of 2.33 in 2 of the following subjects. You have biology, physics, or math, and also chemistry. If you are entering with A level, we need you to have at least grade D in 2 of the following subjects: biology, physics, or mathematics, and also the chemistry. If you are entering by diploma, you need to have minimum GPA of 2.75 in related field, or if you're having a lesser GPA, you need to have 3 years working experience. So for the diploma programs, Diploma Physiotherapy, Diploma Environmental Health, and Diploma in Medical Imaging, if you are an SPM leavers, so you need to pass in Bahasa Melayu and English, and 5 credits in the following subject: mathematics, 1 science subject, and also any other 3 subjects. If you are entering with O level, you need to pass in Bahasa Melayu or English, and 5 grade C in the following subjects: mathematics, 1 science subject, and any other 3 subjects. If you are entering with certificate, you need to have a level 3 MQF certificate in the health science field with minimum CGPA of 2.75. All right, for Diploma in Occupational Safety and Health, which is a 3-year program, these are the entry requirement. for the SPM level, O level, and also the certificate. So for those who have certificate in health sciences related programs, you need to have a minimum CGPA of 2.5. Okay, so why choose FOHS MAHSA? So basically, we have experienced and dedicated staff in our faculty. We also have the laboratories, which emphasize in the clinical skills. We also have the online platform to fulfill the online learning. So our platform here is LMS. We also have a wide list of hospital and institution for the clinical and industrial placement. And our program is basically accredited by MQA and GPA, as well as international recognition, such as dual award with ARU, which is Anglia Ruskin University. Okay, MAHSA also offers scholarship for those who are in need. So we have Haji Abdullah Academic Excellence Scholarship, Foundation Scholarship, Blue Ribbon Scholarship, School Teacher Scholarship, Family Scholarship, as well as the Single Parent Scholarship. So these are our collaborative partners and affiliations. Our student mobility program. And for further details or any inquiries, you can also come and join us in our open day, which will be held on the 19th and 20th March, Saturday and Sunday from 9 to 6 p.m. in MAHSA Sarjana Putra campus. Okay, we welcome you to join us. All right. Okay. So please feel free to contact us through MAHSA website or our faculty Facebook page to know more about our programs, or simply leave a comment and we will get back to you soon. Your questions concerning this webinar session can be listed in the chat box for discussion during the Q&A session. Dear viewers, an e-certificate will be provided for this webinar, and to be eligible for this certificate, please fill in the survey form. The link to the survey form will be provided in the end of the seminar, and it can be found in the comment section. So for the webinar today, basically this webinar will provide you with an overview of the functional MRI and its important role in the medical research, especially in the neuroscience. Some of the emerging clinical application of functional MRI will also be discussed in this webinar. So let's introduce our speaker today. We have an expert speaker from University Kebangsaan Malaysia, Dr. Hanani Abdul Manan. Dr. Hanani actually holds a PhD in biomedicine, specializing in neuroimaging, functional MRI. She was attached to the University Hospital Carl Gustav Karus in Germany in 2020 to pursue her research in MRI. Her research interests include radiotherapy outcomes using fMRI and application of fMRI for pre-operative mapping. So without further ado, let's welcome Dr. Hanani.
Thank you, Ms. Nadia and University. Hi, and thank you, Ms. Nadia and MAHSA University for having me this evening. Thank you very much.
Okay,
and
how are you, Doctor?
Thank you. I'm fine. How about you?
Okay, I'm fine. Hopefully, you're having a very good day today to share your experience and also knowledge with us and the viewers today.
Okay. Yeah. Hopefully, viewers can have something, learn something, and benefit from our discussion this evening.
Okay, so let's not delay your time and the viewers' time. So let's proceed to your presentation, Dr. Hanani. Over
Okay.
to
Thank
you.
you. Okay. Thank you very much. So now I will share my screen. Okay. Can you please see my screen? Yeah. Okay. So for today, we will talk about functional MRI in a clinical setting, the application of MRI in the clinical setting. So, in order for us to do the fMRI, to acquire a functional MRI image, we need to have the MRI machine. This is one of our MRI machine at our center in Hospital Pakar Kanak-Kanak UKM. So in our center, we have two MRI machine. One is this one, 3 Tesla Siemens magnetoskyra, and the other one we have 1.5 Tesla. And both of the MRI machine we have the functional MRI application, so that we can use both for to acquire the functional MRI image. So for today, okay, let's start with the textbook. So this is the most famous among the famous textbook for you if you want to start the functional MRI research. We actually have one fMRI textbook in Bahasa Melayu, but I will share later with sorry, I could not get the picture of the book today, but I will share later. So this is among the books that you can use to learn and to read before you start your fMRI research. Okay, so for today, we will talk about what is functional MRI. And we will talk a little bit about the history of this functional MRI. And finally, we will talk about the research that we did in our center. So what is functional MRI? Okay, functional MRI is not a bumpology. Bumpology is a phrenology, is the study of the size and shape of people's head in the belief that you can find out about their character and abilities from this. This is a bump. So this phrenology believe that we can relate this bump with their character and abilities. But this is not functional MRI. Phrenology claimed that bump on the skull reflected exaggerated function or trait. However, this phrenology mechanism lack any mechanism underlying its claim, and this also used anecdotal rather than scientific evidence. However, what is the similarity between functional MRI and also this phrenology is the localization of function. This is central idea of the functional MRI, which is localization of the function. For example, we have what we call as a eloquent area in our brain. Eloquent area in our brain is the functional brain area. For example, we have area motor cortex here. So this motor cortex will control our movement. For example, we want to move our hand and take this pen, and we want to open this pen. So all this movement is controlled by our motor cortex. So this is one of example of the localization of the function. The other example is also that language and speech. For example, in order for us to speak and to understand speak, there is a network which is involve Broca and Wernicke, which is in our temporal lobes. So that is the example of the localization of the function, meaning that certain area will control certain function of our for example, our movement or our thought, or we want to talk. Okay, so we go to, and fMRI also is not a mind reading. So there is no such thing of mind reading using functional MRI. So this is not a thought, and this is not a thought, and this is not an anti-thought. Okay, and the most important thing is fMRI is not invasive. For example, here this is one of the technique we call intracranial stimulation or intracranial recording. So for this technique, we need to cut open the skull in order for us to get response of this intracranial stimulation normally used during intraoperative, during brain surgery. Okay, the situation is sometime when we have tumor inside the brain, this tumor invade the eloquent area. The eloquent area is the functional brain area that I mentioned just now. There is, for example, a motor cortex for the movement, and also Broca and Wernicke and the neural network at the temporal lobe, which related to the language. So, for example, we have a tumor, and the tumor invade this, for example, this motor cortex. So, the main aim in the brain surgery not only to remove this tumor, but we want also to have a patient to have increased their quality of life. We don't want that then we remove the tumor and the patient will be cancer free, and suddenly the patient cannot walk, cannot move the hand. So that's why we're using this intracranial stimulation because we want to make sure that we do not take up this functional brain area. This intracranial stimulation is the gold standard for this intraoperative mapping, but this lacking because of the invasiveness that we need to cut and open. So in our lab, we try to use functional MRI so that we can have the same outcome. However, this is still under study, under research. Okay. So the second one is the PET, positron emission tomography, which is PET. PET is not invasive, but this PET using radionuclide, which is we need to inject the radionuclide, and radionuclide will be inside our body, and it involves radioactive. Okay, but fMRI is not invasive, and also do not use any radiation material, and not radioactive. And in functional MRI, we use high magnetic field to get the image. Okay, so functional MRI is a technique for measuring metabolic correlate of the neuronal activity, and we use a standard MRI scanner, normal MRI scanner, but we need to have a special software, which is the functional software. And we will acquire a series of images, meaning that many images will be acquired during the task. And what did this fMRI measure? They measure the changes in the blood oxygenation. And this use non-invasive and non-ionizing radiation. And we can do fMRI many times, repeat many times, and then can be used for a wide range of subjects. Okay, and this fMRI combine good spatial and reasonable temporal resolution. That's why it's become among the famous neuroimaging technique used nowadays. Okay, so now we go to what does fMRI measure? Okay, first and foremost, electricity is the language of the brain. At any moment, there are billions of tiny electrical impulses, which is action potential, whizzing inside our brain. At the synaptic junction, this impulse release specific chemical, what we call as neurotransmitter, which in turn will modulate the electrical activity in the net cell. So, for example, now while I'm talking, all the electrical impulse and action potential are whizzing around inside my brain, and this electrical impulse is always there, 24/7 during your whole life. Okay, so this is the fundamental basic of the neuronal communication. somehow these processes underpin every thought, feeling, action you have ever experiences. So this is will happen the whole our life. Okay, so however, this functional MRI does not exactly measure this electrical activity, because compared to other neuroimaging techniques such as EEG, MEG, intracranial neurophysiology, all these three techniques will measure the electrical activity, but rather functional MRI measure the indirect consequences of the neural activity, what we call as the hemodynamic response. So this is the pathway. So this is a hemodynamic response, which is from the neurovascular coupling, and this is what we will detect in our functional MRI scan in the fMRI, what we call as fMRI ball response. This is brain activation that we are looking for in the functional MRI research. Okay, so this is one of the YouTube. I found this YouTube is very interesting because it is easy to understand, and those who just started to learn and want to venture on this functional MRI, this is very helpful because it's very easy to understand, and yeah, this is very helpful for those who just started this functional MRI field. Okay, so let's summarize the three key principles of what does fMRI measure. So in the figure here, we can see that resting state, and this is activated state. So we can see here oxygenated blood and deoxygenated blood. There is a difference between the resting and the activated. Okay. We can see in the activated there is a lot of oxygenated and deoxygenated compared during in the resting brain. Neural activity is systematically associated with changes in the relative concentration of the oxygen in the local blood supply. Oxygenated blood has different magnetic susceptibility relative to the deoxygenated blood. Changes in the ratio of oxygenated per deoxygenated blood, this is what fMRI measure, which is the changes in ratio of oxygenated and deoxygenated blood. And this is what we call as the hemodynamic response function. And this can be inferred with the MRI by measuring the blood oxygen level dependent, which is what we call as Ball response. Okay, so fMRI provide an indirect measure of brain activity, and we can relate this with the classic thermometer, which does not directly measure the temperature, but rather the volume of mercury in a glass tube. Because these two parameters are tightly coupled, a well-calibrated thermometer does a nice job of the tracking temperature. But now we are not most of the time we using the digital, which is we not using this mercury thermometer anymore. Okay. So this is continue from previously about the what fMRI measure. So this in the active region, the active area of the brain, there will be increased neuronal activity and induces changes in regional blood flow, blood volume, and also oxygen extraction through the process known as neurovascular coupling. So this is term used in the fMRI. Although the Ball signal does relate to the number of firing nerve cells, it's more closely correlate with the extracellular local field potential, which is the LFP. LFP are slowly changing voltages recorded from large population of the brain cell, which a much longer time course than depolarization spike. Okay, so this LFP will reflect the total activity of regional neural network, including not only neuronal discharges, but also the sum of positive and negative postsynaptic potential at multiple dendritic connection. Therefore, the regional Bohr response generated from a brief peripheral stimulus is known as the hemodynamic response. The HRF typically demonstrated as initial dip followed by tall peak and then a variable called as post-stimulus undershoot. So this is what we call as the Bohr response. We have three main component here, and this is initial dip. The mechanism of the initial dip is remain disputed. However, the two most popular theories being that the increase of the early metabolic extraction of the blood oxygen, and also the other one is due to the increase of local cerebral blood flow at the particular region, depending on the what task being given, for example, in the fMRI study. So then we have here the peak. This peak is result in the ratio of oxyhemoglobin to the oxyhemoglobin transiently increases with the increase of the MRI signal. Okay, and then we have here the post-stimulus undershoot, which is most commonly observed in prolonged stimulus experiment. So this is the Bohr response we will have when we only have one stimulus here. When we give one stimulus here, and we will have this initial dip, and then we have peak, and then we have the decrease of the signal, and we have post-stimulus undershoot. This is what happened when we give a long train of repeated stimulus are applied. So here we have a few repeated stimulus, so that what we can observe here, the dominant peak become a broad plateau and not dropping off until the end of stimulus. So this is the stimulus, so this is the dropping of the peak. So a small initial overshoot may sometimes be observed here. Okay, so this is a Bohr response, but this is compared. This is when we give only one stimulus, and this is what happened when we give a long train of repeated stimulus. Okay, so now let's go about basic functional MRI. So first, we need to differentiate between MRI and functional MRI. MRI is a study of brain anatomy, and meanwhile, functional MRI study of the brain function. For example, motor cortex control the movement. Broca, Wernicke, and the network of the temporal lobe will control the speech and language. That's what we call the function. Okay, the fMRI is yet to be introduced for diagnostic purposes and is only used in the experiment. Okay, yes, this is true. Now, functional MRI still in the experimental phase, but we slowly try to apply this fMRI technique in the clinical setting. For example, in our lab, we use functional MRI as the pre-operative mapping tool. We try to apply this technique to help the neurosurgeon to locate the eloquent area. Okay, and this one, the functional MRI is considered to be most expensive than the MRI because of the additional software and hardware required. Yes, that is true, because in a functional MRI, we need to have a task. And this task can be either visual or stimulus, and we need an apparatus and hardware that is MRI compatible. Okay, this MRI compatible is the one that because we use in MRI machine, we use very high magnetic field. So that's why we need to have a special hardware that compatible with this situation. And this is relative, and this hardware is relatively expensive. Okay, this is again a comparison. So this is for the anatomy. We have here we can have gray matter, white matter track using DTI, and finally this is a MRA. This is functional MRI. Functional MRI can be used to evaluate the task-related activity, brain connectivity, and also physiological connectivity. And we can do all this using our functional MRI. Okay, so here we take a sequence of images acquired over time and study how things change across time. So in fMRI, we will take many images, okay, to see the response. So this is the different between other modality. Each functional neuroimaging modality provide a different type of measurement of the brain. They also have their own pro and con with spatial and with regard to spatial temporal resolution and also invasiveness. But functional MRI, however, what is good about functional MRI is functional MRI provide a nice balance between these properties, and functional MRI has become the dominant functional imaging modalities nowadays. Okay, so this is there is a few. This is among the neuroimaging technique available. We have MEG, EEG, and both fMRI, PET, and also ASL fMRI. And the spatial and temporal resolution for different type of imaging modality. The x-axis here, we have the temporal resolution from a millisecond up to days here, and y-axis here we have spatial resolution from microsecond until to centimeter. So this MEG, EEG, and PET, and also what we call as ASL fMRI and BOLD fMRI, all cover spatial resolution in the centimeter scale. So this can be used to study a large scale of network of the brain. Okay. Okay, so this fMRI study is a multidisciplinary community, which is we need experts in each discipline to work together. For example, we need psychologists, physicists, neuroscientists, engineers, and also clinicians. For example, in our lab, we have brain tumor. So we need brain surgeon. And also some of this brain tumor patient will come with the neurological deficit. And we also need neurologists. And also we need the psychologists. And we also need engineer and computer scientists for the data analysis, because we aware that in functional MRI study there is high signal to noise ratio. That's why we need expert so that we can work together to get the better outcome. Okay, tools necessary for functional MRI. We need to have a high field MRI, which is 1.5 Tesla and greater. This is for a BOLD effect, which is functional MRI signal, which is increased with high field strength. And then we need to have, we use in functional MRI, fast imaging sequence, which is echoplanar imaging. EPI, and we have the stimulus presentation equipment. This is what I mentioned just now, the additional hardware that we need for this functional MRI. Which is a projector to show visual stimuli, response button, devices such as button box to record subjects' response, and also headphone for auditory stimulus. Okay, so this is all among other the equipment or hardware that we need for this fMRI setting. Okay, this is the flow of the fMRI research, and this figure is taken from the Jose et al. 2016. Okay, so first we need to have the application field, and we need to have experimental design. Our experimental design is totally based on our objective and aim. And so here in fMRI, we have two types of functional MRI. First, we have resting state, and the other one, we have the task-based functional MRI. What is the difference between two is, in resting state is we put participant inside the MRI and we ask the participant not to think about anything, just lay down and clear their mind. So this is why they call resting state, because we scan participant during at rest, meaning that they rest, they did not do any mental work. So that we call as resting state. This one is much easier, and the other one is we call as task-based fMRI. Task-based fMRI meaning that we need participant or patient inside the MRI need to answer our task, need to solve our task. It could be the task can be that can be delivered via auditory stimulus or visual stimulus. Okay, so there is a few more that we can use as a task. So this is the different one is we scan the patient when they are doing nothing, and the other one is task based. We scan the patient when patient are respond to our stimulus, our task. Okay, so for the task-based fMRI, there is three types of experimental design, what we call as block design, event-related, and finally sparse paradigm. Okay, we go in detail after this about these three types of experimental paradigm, but we go back here again. In functional MRI data, we will we need to design our experimental design so that match with our need, which match with our objective, and this we need to carefully choose an appropriate experimental paradigm for that particular what we're going to study. For example, if we want to evaluate the language area, for example, we need to have a specific task that can evoke the activation in the language area. We cannot use a speech paradigm to and then we suddenly want to evaluate the language. We cannot do that. So that's why this is very crucial part, which is that this experimental paradigm need to be specific on the our objective and also our interest. And I also mentioned just now that signal to noise ratio is high in fMRI data, so that's why we need to have a very robust data processing technique. And we have the quality control and pre-processing, analyzing method, and finally statistical analysis. This is why we also need a statistician in our functional MRI team, because we need to make a inference in our data, and finally report and interpretation of result. Okay, So this is the flow of fMRI study. Okay, now we go back to the what is block design and what is the event-related design. So from here, we can see that red one here is the stimulus A, and blue here is the stimulus B. And this is the block design. This block design is the most straightforward paradigm to implement. And what we can see here, in this event-related design, the stimulus is more randomized rather than being blocked together by the condition. So for data processing, this block design is much more easier to analyze compared to this event-related design. Okay. Functional brain mapping with MRI, a basic concept. Changes in neuronal activity produces a measurable change in MRI signal. Okay, normally for fMRI, we will collect around 100 to 500 MRI scan continuously. So this number of scan also depend on our aim of the study, and also what we are going to evaluate. And in functional MRI, we will use 2 TR. We call here is a TR, time to repeat, which is 2 or 3 minutes to scan the whole brain from up here to down here, or the down here or to up here. So 2 to 3 seconds, maximum 3, and typically cover 30 to 50 slices. These slices, this number of slices also depend on our objective of the study. Okay, this is one of the basic functional MRI experiment. This is thumb movement. Okay, so this is so here we are using here is the block paradigm. Okay, block because we have passive here and we have active here. For in passive, normally we put the fixation so that the participant or patient know that during fixation they will doing nothing. They just stare at the fixation here. And during this active, we will ask the participant or patient to do the task. For example, here they do the thumb movement. Okay, maybe thumb movement. So during this active, there is a screen or there is an instruction. A patient will be given instruction before they enter the MRI. And also sometimes they also try outside MRI first, so that they will be familiar during inside the MRI. So here there is an instruction so that patient will do the anything task that they are asked to do. Okay, so block here, passive, active, and so on. Okay, so this is actually what we aim for. It is in functional MRI. We want to evaluate this brain activation in response to this task. Okay, this is our data analysis. Identify vox cell with signal changes matched to the timing of the experiment. For example, here tapping. Normally they use finger tapping. Okay, now this is what we get, the brain activation. For this study, maybe they ask the participant to first tapping right, and then tapping left, tapping right, tapping left, and then they sum up. So this is the result they get. So for the right thumb, they got the brain activation here, and for the left thumb, they have the brain activation here. So here, this is the color coded here is represent intensity of the activation. Okay, then there is also activation here. Okay, so this is what we are trying to evaluate in functional MRI study. Okay, so we can we can go a little bit this is very brief history of functional MRI. Okay, timeline of MRI, and the functional MRI started here in 1990. 1990. Okay, when Ogawa and colleagues create functional images using endogenous blood oxygenation contrast. So just about started about 30 years ago. So this is fMRI just started compared to the MRI itself. Okay, this is a 5 Nobel laureate for MRI. So this is the one, the person that contribute in MRI, the progression of the MRI and also functional MRI and what we have today. Okay, this one already. Okay, so this is using MRI to study brain function. This is the first study about functional MRI published by Kwong et al. 1992. This is among the first study on functional MRI. Okay. Okay, so this is I'm very sorry for this very old 2004, but now I can tell you that the field is keep growing and keep growing. This is the published study on functional MRI. Okay, and finally, we will we will talk about MRI application in clinical practice, which is what we are doing in our lab in UKM. Okay, first, let me introduce first why we want to try to apply this functional MRI technique for preoperative mapping. Okay, so the gold standard technique for the preoperative planning is the DCS, which is direct cortical stimulation, because this DCS has spatial and temporal resolution. However, this technique is invasive, time-consuming, and dependent on the awake craniotomy for its validation, meaning that patient need to undergo awake brain surgery, meaning that during the surgery, patient will be awake, meaning that the first part of the surgery, patient will be sedated, and then after they cut and open the skull, the patient will be awake, so that they can test using this direct cortical stimulation. And this technique also, we need to have a very expert NS to do that, and not many NS can have this experience doing this awake surgery. So this is one of the limitation of the direct cortical stimulation. And the other gold standard also intracarotid sodium ammobarbital, which is WADA test. This is also a invasive technique. That's the main reason, the main why we try to apply our functional MRI for the preoperative mapping or planning in brain surgery. Okay. However, we still do not have the concrete conclusion on this, whether we can use or not the functional MRI, and the research is still going on. Okay, this is one of the example, part of the brain that controls speech. We have here primary auditory. This is one of the what I mentioned just now, the functional brain area or the eloquent area, which is we have for the speech, we have primary auditory cortex here. We have a vernix area, acute fasciculus, and we have motor cortex, and we have Broca area. So all these networks is working together, connecting each other in order to control the speech. So this is the function of each of this area during speech production. Okay, so in our lab also, this is our master student. So what she did is she used this is resting state fMRI. They use resting state MRI, and she evaluate the default mode network, and she compare default mode network in healthy control and patient with a brain tumor. So there is a differences between the networks, which is in the study she evaluate the default mode network DMN. DMN is the most famous or most popular network in resting state functional MRI, because this is the very easy, not very easy, easiest to get the region of interest. Other than this DMN, there is other more resting state network that we can evaluate. For example, executive function, motor, and so on. There is, but in this study, the student in our lab measure the differences between healthy control and patient with brain tumor, and specific to this network. And she found that there is a changes because of the tumor. Okay, this is our student, also our student, which is our PhD student. She used task-based functional MRI, and she used block paradigm. Okay, here you can see this is block paradigm, rest, active, rest, active. Okay, so this is the arrangement inside the active. There is a few. She will pop up a few picture with the description, and the participant or patient is asked to match between the picture and the description. For example, here Ali meluncur salji, so that mesh between the picture and also the description. So maybe she will use the respond button, so that if the correct mesh, the participant need to right click or left click or something like that. And then for here, example here is Nina makan durian, which is not mesh because of this girl is coloring or drawing something, the sign. Okay, so this is example of the task that we can use in a task-based fMRI using block. Okay. Okay. This student, they evaluate the also evaluate the brain tumor patient and compare to the healthy control. And the other field that try to apply this functional MRI is to diagnosing olfactory dysfunction. The gold standard for diagnose olfactory dysfunction is psychophysical olfactory function test. However, the test is rely on patient self-reporting and require patient cooperation and intact cognition. What here, for example, in brain tumor patient, sometimes because of the tumor invasion, this patient come with the neurological deficit, and sometimes they have the cognition deficit. So that's why we also try to apply fMRI to diagnose this olfactory dysfunction. This also still in the middle of testing this research to use fMRI to diagnose the olfactory dysfunction. Other than that, this is other research that we did in our lab. First, aging effect on working memory and speech perception. We evaluate the effect of aging to working memory, and we found that there is a decreased intensity in all the participants in the dorsolateral prefrontal cortex, which is area that involved with working memory. And we also found that there is a compensation. And compensation, that is an area that not activate in the younger, is activate at the older participant. And of course, we will relate all this functional MRI finding with the neuropsychological assessment, for example, working memory capacity. And other than that, we also, in our lab, we also do the neuroplasticity in patients with a brain tumor. For example, some of the brain tumor patients come with the neurological deficit because of this tumor invasion. And then we will have a baseline scan, which is before the surgery. First baseline scan for MRI, and then the patient go to the surgery, and then after 3 to 6 months later, we scan again that particular patient. And at the same time, we'll also did the neuropsychology assessment, baseline, and also after 6 months surgery, so that we evaluate if there any correlation with the neuropsychological assessment. And also we want to evaluate the plasticity or changes after we remove the brain tumor. What happened to the brain network? Okay. And this one, this is not started yet, the study, but we already sent for the ethic for COVID-19 patient. There is a study show that this COVID-19 virus can go through the brain-blood barrier, so that and we also found that some of the COVID-19 infection patients complain that they have they feel a little bit blur, and sometimes they have problem with the memory. So in this study, we want to evaluate what actually happened, what this COVID-19 virus did to the brain and to the neural network, and how this changes alteration because of this virus. And this is also, and then we also do the toxicity due to the radiotherapy treatment. This one is also a good study, because of during radiotherapy treatment for the head and neck cancer, normally the field of radiation beam will be around here, and then also involve the temporal area of the brain. And that's why we want to evaluate the cognitive and cognition of that particular patient due to this radiotherapy treatment. And then we have also SCAR3 patient. SCAR3 is the neurodegenerative disease. And we want to evaluate these three halos. Is it improved or not, this condition of the patient? And then finally, which is not really clinical application, we also do the psychology thing, which is we compare between TAFIS and non-TAFIS studies on the working memory and emotion regulation. For example, both TAFIS and non-TAFIS study have the similar working memory capacity, and we want to evaluate these tahfiz because they have a component of hafazan, which is how they control their emotion, how good compared to this non-tahfiz. Okay, so this is among the research that we did in our lab in PPUKM. Previously, we are in the PPUKM, Hospital UKM, but now we shift to the Hospital Kanak-Kanak UKM, Hospital Pakar Kanak-Kanak. Okay, this is our collaborator, co-researcher. We have here neurologists, we have a brain surgeon, and we have a neurologist, and we have psychiatrists. And this is, we have collaborator outside. We also have a collaborator from outside, national and international. And finally, we have our experienced radiographers, and we have many and many more. Okay, so with that, thank you very much. Thank you, and I will stop sharing my screen.
Okay, thank you, Dr. Hanani, for the insightful presentation. So, our viewers today, if you have any question for the speaker, please leave a comment on the chat box. I believe we have 5 questions today. So, let's start with the first question, Dr. Hanani. So, the first
Okay,
question is from Umi Maisa saying that when should we use resting state fMRI or task-based fMRI in the clinical practice?
Okay, for resting state fMRI, for example, some of the brain tumor patient come with us with the cognitive deficit. For this situation, we will use a resting state fMRI because of for if you use task-based, patient will be unable to answer the question because of the condition, which is cognitive deficit. And this is depend on the patient situation itself.
Okay, all right. So that's the explanation. Oh, another question. Umi Maisa seems to be very interested with the topic. How much is the cost for fMRI in Malaysia?
Okay, this is for actually the price, the cost is different, varies from institution to one another. For example, in UKM, for research study, if involve the lecturer inside UKM, we charge about 200 ringgit for the use of the machine and 50 ringgit for the radiographer per participant. So about 250 ringgit for each scan.
Oh, okay, all right. So hope that explains the Umi Maisa question. All right.
Our cost is the cheapest, I can assure you.
Okay.
Our price, yeah.
So from SA Munira, good evening, madam. I would like to ask, what is the function of fMRI in psychology?
Okay, thank you. Okay, thank you, Munira. Okay, in psychology, for example, we also, in brain tumor patient, for the patient itself, sometimes when they have the what we call temujanji, they sometimes they feel very anxiety, we feel very stressed. Okay, that's some. We also in our lab we also did this, which is we scan the psychology part, which is anxiety and stress due to the tumor, due to the cancer. Yeah.
Oh, all right. Okay. So, any other question? I believe we'll have another one question. Okay, from Arwazin, in fMRI, if the patient keep thinking about complicated things during the scanning, does that affect the diagnosis and does it consume the same time as normal MRI?
Yes, that yes. For the first question, if patient for example, in resting state, normally we ask participant not to do not. We ask participant to do nothing, just lay down inside. But suddenly, the patient or the participant think about mathematical to mathematical or thinking about their problem or anything. Yes, this will affect the signal that we capture. And okay, and the second question is, does it consuming the same time as normal fMRI? No, it is varies. So in fMRI study, it depend on the experimental paradigm, experimental task. For example, in resting state, we can have a minimum 10 to 7. Sometimes there is a this is depend on the research. Sometimes the minimum is 7 and up to 50 minutes in resting state. But for the task-based fMRI, we can have up to 30 minutes. But this is not advisable, but because of patient will or participant will be very tired and they start to move. So yes, so we need to have as minimal as we can. And at the same time, we want to capture and we have to want to have the good sample size. So we have to be balanced between the long scan and the also sample size.
Okay, all right. So, okay, from Hanis MHS. Hi, doctor. Which one is better, resting state fMRI? Or I think this one we have already asked just now. Dr. Hanani already answered this question.
Which one is better? Okay, which better? Yes, yes. Which one is better is it depend. It depend. It depend on what type of tumor, which part of the brain involved. Okay, so other than a patient itself, we also need consider to the tumor itself. Where is the tumor location? What size of the tumor? Is it invade the equilibrium area? Okay, so this is need to be taken into consideration. So
Okay.
researcher will decide which one.
All right. Okay, I believe that's all the question that we have this evening. So, viewers, as mentioned, the e-certificate will be provided to the eligible participant. So you need to fill up the form that we already posted in the comment section. So with that, with all the questions, we thank Dr. Hanani for joining us today. And to our keen and attentive viewers, thank you for joining our webinar. We look forward to your comments and participation in our future events hosted by MAHSA University. For further queries of our programs or any inquiries, please contact us through MAHSA website. Also visit our social media and do log on to www.mahsa.edu.my. So till then, Assalamualaikum. Thank you very much, Dr. Hanani, for the sharing session. Have a pleasant day. Stay safe. Thank you and bye-bye.
Thank you again. Thank you,